So I'm Dr. Hedde, and I started the practice Direct Doctors here in Wickford about 5.5 months ago. Patients, when they come to my practice, they walk right in the door. They don't have to wait in the waiting room around other people. They spend at least a half an hour with me, if not longer. Whatever the patient needs, I'm happy to spend. Direct primary care is a new concept that's been spreading from the West Coast. Mine is the first practice here in Rhode Island offering this kind of care. So patients pay me a monthly subscription fee, which covers all access to me. It's between $50 and $100 a month for adults, and then $10 for kids with a parent. And that allows them to have this unlimited access for visits to meet all of their primary care needs, which is really what most patients need. Patients have my cell phone, they have my email, they're able to text me, they can really get in touch with me 24/7 with whatever comes up for them. I also offer home visits for patients at Direct Doctors. For all newborns during the first month of life, I do all their visits at home. And then for all my other patients, if anything comes up and they really can't make it to the office, I'm able to go and see them at home. I grew up in Massachusetts and have been in Rhode Island now for about 4 years. I did my residency training here at Brown in family medicine. I've also found that a lot of my patients end up having insurance who join the practice, although I am able to provide care to patients without insurance or with any insurance coverage. So I decided to start this style of practice here in Rhode Island because I found, both as a patient and as a mother and as a physician, that this typical model of insurance practice was not all that it was cracked up to be. I felt that there must be a better way, a way that patients could spend more time with their doctor and have a better patient-doctor relationship. I also felt, as a physician in a typical practice where I was before this, that I was constantly feeling rushed. I was looking at the clock, I was spending very little time with patients. I wasn't really getting into good medicine. I was just sending patients out the door to do blood tests, to see a specialist, and not really spending the time I wanted to get to know patients.
My name is Lishazon Frilly, and I'm a new patient to Dr. Hedde.
My name is Gail Squilanti, and I joined Dr. Hedde's practice in August of this year.
Miraculously, a link popped up about Direct Doctors on Facebook, so I clicked on it and wanted to see what it was about, and I saw that it was a flat rate each month, which was good because I'm self-employed and I don't have the best health insurance, so it was going to work really well. And so when I came here, it was very comfortable and I didn't have to wait in a waiting room with a bunch of sick people all the time. And so when I got here, it's very homey and she's very personal, and I like one-on-one interaction. And
so when I saw Dr. Hedde's ad in a local newspaper, I decided to give her an interview, and then I found out how happy I was with the kind of practice she was offering. I was able to come in and have an appointment whenever I needed to. I was able to reach her by phone whenever I needed to. I also could email her with any concerns I had. She has helped me work through a lot of chronic medical and personal problems, and I feel like I have established a relationship with her.
I like it, and I recommend it to everybody.
I feel anybody who's interested in changing doctors and is looking for a great doctor, to give Dr. Hedde a chance to get to know you.
So I've now been practicing just over 5 months, and the response has been really overwhelmingly positive, and I think patients are really happy with this sort of new and different and exciting experience.